C. Costales, your student nurse for today's assessment from Our Lady of Fatima University. So, first step is I am going to check the chart of the patient for preventing and para malaman natin kung ano yung kalagayan ng pasyente natin before natin siyang gawan ng assessment. And second, we are going to gather all the equipments that we need. So here we have the water, the gloves, and alcohol. Next step is we are going to perform hygiene and to wear a PPE. So we are going to put gloves to prevent any spreading of microorganisms all throughout the assessment. So after we put PPE and sanitize our hands, we are going to identify our patient. So, good day ma'am, can I have your name,
I'm Luna Martin,
your age,
18 years old.
and your birthday?
October 2, 2007.
Okay, thank you po ma'am. After we identify the patient, we are going to explain the procedure na gagawin natin sa kanya all throughout this assessment. So, ang gagawin po natin ngayon, ngayong assessment is bed bathing, shampooing, oral care, and back massage. So, we are going to do that with the conscious patient po. And next steps, we are going to provide a privacy for the patient. So, ma'am, allow me to close the curtains for your privacy throughout the assessment. Okay. So, yan. Assume that I close the curtains or the door for the privacy of our patient. So, the next step is we are going to position our patient in a comfortable position. So, ayan. Hindi ko lang inayos yung position niya, but I also fix the blanket sa kanya para walang naka-expose sa kanya. And next step, we are going to place a bath blanket sa head and sa chest niya for the privacy. So, we have the blanket. The chest po. And after we put bath blankets, we are going to prepare the water na naipapahid natin sa kanya sa bed bathing. And we have here this washcloth for ito yung ipapahid natin sa katawan ng pasyente natin. So, ayan. So, pagbasa na, we are going to apply this sa face muna ng pasyente. Eyes muna, both eyes. And then, after sa eyes, sa forehead to cheeks. And then sa ears and neck. And after nating ma-apply yung water sa kanya, we are going to pat dry dito sa ating tuwalya na dry. Yung kanyang mukha na okay. And next step, we sa ano naman tayo, arms naman ng pasyente natin. So, itong tuwalya na to is ilalagay natin siya doon underneath the arms na lalagyan ay babat natin. So, just expose the hand na ibabat nyo lang. And then, put the towel underneath the arm. And then, same procedure lang na ipapat natin tong wet na washcloth na to. And then, sa hands din na. After that, ipapat-dry mo ulit siya dito sa tuwalya na nandito sa underneath ng arm. And then, ibabalik natin yung kumot para sa privacy ulit ng patient natin. And then, since hindi ko maabot yung other side ng arm niya, assume that I already cleaned the other side ng arm niya. Pero same procedure lang yun ang ginawa ko dito sa side ng arm niya. Sa may right side ng arm niya. And then next naman is the legs and feet niya. Same procedure lang. We are going to expose the legs lang and foot na i-babat natin. So, ayan. And then, maglalagay ulit tayo ng bath towel underneath ng legs and foot na ibabat natin. And same procedure, the washcloths and water. And then, ipapat nyo lang siya sa legs nung pasyente nyo na parang binabat nyo talaga siya. So, legs muna, sa front ng legs and then sa back ng legs. And then, sunod nyo yung kanyang foot. And after yung lagyan ng ng water, you are going to pat dry naman sa ating bath towel yung binat nating legs and foot. And then after that, you are going to remove the bath towel and then give the privacy ulit. And then next is shampooing. We are going to shampoo our patient. So, I have here the pitcher. So, i-assume po natin na meron tong water because we don't have a shampoo tray. Kaya hindi natin mape-perform yung pag-shampooing talaga ng actual. So, we have here the pitcher na may laman. We assume that may laman and may water siya. And then, after nyan, may water to, ang gagawin natin is, bubuhos natin doon sa head nung pasyente natin itong pitcher na may water before tayo maglagay ng shampoo. So, ibubuhos natin siya. And then, after, kunin natin yung shampoo, and then, i-apply natin doon sa head ng pasyente natin. And then, we are going to massage the head of our patient habang meron siyang shampoo. So, after natin i-massage yung shampoo sa kanya, we are going to rinse it with water. So, may water ulit to. And then, we are going to rinse yung shampoo sa head niya. So, after we rinse the shampoo, di ba meron tayong towel na nilagay sa head ng pasyente natin, and we are going to pat dry the hair or the head of our patient. So, pataas po ng and then we are going to pat dry like that. Yan. And then, tatanggalin na natin yung towel. So, after the shampooing, we already have the oral care. But, before that, magpapalit muna tayo ng gloves and magsasanitize tayo ulit. So, sanitize natin yung ating hands and maglagay tayo ulit ng gloves. So we are going to do the oral care. We are going to brush the teeth of our patient and going to floss it. So para ma-avoid din natin yung bad breath or the halitosis sa ating pasyente. And kaya tayo magpo-floss para din mapanatili natin healthy ang ating mga gums and no complications na makuha sa mga gums natin and sa mouth. So, after na ang ating paglagay ng gloves, we are going to get our basin and our cup. So, ang gagawin natin dito sa dalawa na to, papainumin natin ng water yung ating pasyente and we are going to tell the patient na i-spit yung water dito sa basin before tayo mag-brush ng teeth. So, ma'am, so, ipuposition ko muna ang aking pasyente sa pag-upo. Oops. And careful na ma-expose yung katawan ng pasyente natin. And then, ma'am, can you drink water and spit out? So, assume that the patient spit the water in the basin before tayo mag-brush ng teeth. So, we have here a toothbrush and we are going to brush the teeth of our patient. So, brush the teeth. So, again, same procedure. Pag-spit out mo ulit yung ating pasyente dito sa basin natin. So, So, after that, floss naman. So, we don't have floss here. So, assume that the nurse do the flossing in the patient. So, the last step naman, the last procedure, is the back massage. So, I am not comfortably massaging my patient ng may gloves. So, aalis natin yung gloves. Instead, sanitize na lang tayo para kahit pa paano, pa rin siya. Parang sanitize pa rin ang ating mga hands. So, ibabalik natin ulit yung pasyente natin sa pagkahiga niya. And then, we are going to position our patient sa prone position or yung nakaside siya. So, ma'am, side na. And, i-expose lang natin kung ano lang yung ibabak massage natin sa kanya. So, specifically, the back lang yung i-expose natin. So, and then, tataas natin yung kanyang, ayan. And then, we have here, lotion, and i-massage natin siya. So, ayan. So, after natin i-massage, ibababa ulit ang kanyang damit and ibabalik na siya sa position niya. So, that's all the procedure na ginawa natin, the bed bathing, and then the oral shampooing, oral care, and the back massage.